The greatest health threat we face after 50 rarely announces itself. Instead, it arrives quietly, masquerading as normal aches and pains of aging. We are conditioned to expect a dramatic, agonizing clutch of the chest, but leading global health organizations note that cardiovascular disease operates as a gradual spectrum. This creates a dangerous overlap. When the early warning signs of a struggling heart look completely identical to the routine fatigue of aging, we miss critical biological signals. By accepting a sudden loss of stamina as inevitable, we unwittingly ignore the body's earliest attempts to save its own life. Take Robert, age 67, and Susan, age 63. Both were active, both enjoyed the outdoors, and neither of them smoked. They fit the profile of reasonably healthy adults. Over several months, Robert noticed subtle changes. Walking uphill became difficult. He occasionally felt a vague pressure in his chest, but only during routine tasks like carrying groceries. For Susan, the experience was entirely different. She began experiencing increasing fatigue, frequent mild nausea, and shortness of breath while tending to her garden. She never had a single moment of chest pain. Both assumed these shifts were simply the cost of aging, but medical evaluations revealed significant coronary artery disease for both of them, catching the condition right before a major cardiovascular event occurred. The most dangerous phase of heart disease often precedes the physical attack. It is the psychological blind spot where we casually dismiss subtle discomfort as normal. To understand why the heart communicates distress through seemingly unrelated body parts, we have to look beneath the surface at the physiology of circulation. This diagram shows a cross-section of a beating heart. Breathlessness and fatigue occur as a supply and demand failure. During exertion, the heart struggles to push enough oxygen-rich blood through narrowed arterial pathways, starving the muscles of the energy they require. The body's alarm system is highly complex. Distress signals from the heart travel up shared nerve pathways into the upper body. This causes what is known as referred pain, radiating discomfort into the shoulders, neck, and jaw. This creates a stark contrast in how heart disease presents. On one side, you have the localized heavy chest tightness that Robert experienced. On the other, a web of dispersed warning zones throughout the upper body. Symptoms do not have to originate in the center of the chest to be cardiac in nature. The body simply routes its warnings through a vast network of unexpected alarms. These alarms trigger systemic issues as well. Dizziness and lightheadedness occur when reduced blood flow struggles to reach the brain. Swelling in the legs, ankles, or feet can also appear. The heart's decreased pumping efficiency leads directly to fluid retention in the lower extremities. This infographic highlights a critical divergence. Women frequently experience heart disease differently than men. As Susan's case demonstrated, symptoms like nausea, back pain, shortness of breath, and extreme fatigue often occur entirely without severe chest pressure. These systemic failures are driven by underlying trackable factors. High blood pressure, elevated cholesterol, physical inactivity, and chronic stress all compound the strain on the cardiovascular system. By understanding these diverse, gender-specific signals, an invisible, abstract fear becomes a set of trackable, recognizable data points. Because Robert and Susan listened to the subtle whispers their bodies sent, they avoided a major medical crisis. Today, they both continue their active lifestyles through early intervention and managed care. Their success reflects the core principles of the Golden Heart Checklist. This serves as a proactive toolkit designed to preserve long-term independence. The first pillar is knowing your numbers. Partner with a healthcare provider to monitor your blood pressure, your total cholesterol, and blood sugar levels. The second pillar focuses on movement and nourishment. Incorporate low-impact activities like walking or swimming, while adopting a diet rich in whole grains, fish, and limited sodium directly supports arterial health. These daily choices act as the physical infrastructure of a person's future freedom and mobility. That infrastructure relies on restoration. Consistent, quality sleep is a biological requirement for cardiovascular wellness. Chronic poor sleep actively increases the risk of heart disease. Stress management follows the exact same logic. Practices like deep breathing, maintaining social connections, and spending time outdoors function as biological necessities for regulating the heart. Paying attention to the quiet signals your heart sends secures the years ahead. It protects upcoming family moments, travel plans, and life's simple joys. To further protect those years, join us in our next episode, where we explore the evening habits that harm longevity. Ultimately, cardiovascular wellness is not a single medical event. It is the continuous, intentional preservation of the life you have got.
Remember, life after 50 isn't about slowing down. It's about living stronger, healthier, and happier. If you enjoyed this video, please like and subscribe, and share it with someone you care about. This is Longevity After 50, adding life to years, one step at a time.